curious, what do you think the future is? How is traditional, psychiatry and traditional medicine taking to this where you are? What's your experience of that?
I mean, psychedelics are, they're no longer fringe. They
Mhm.
are mainstream in the way that they're being approached in Western medicine. I think we're at a very interesting time because psychiatry has been failing for years, with the exception of psychotherapy.
Mhm.
Psychotherapy, some forms of psychotherapy can be very effective. But in Western medicine, it was largely considered, like the joke specialty,
Mhm.
and there were loads of talks about maybe it should be degraded from actually being medicine.
Hmm.
And it's a different kind of qualification. So I think that psychedelics have given psychiatry a lot of hope. But what we're seeing now is disillusionment with the results we're getting from these clinical trials. And I think a lot of the reason for that is because the psychedelics that we're using, most of them are serotonin agonists, right? So they work in a similar way to most antidepressants. They prevent the reuptake of serotonin in the brain. Serotonin is loosely the happy chemical, so therefore it makes you, more happy, amongst other things. There are many other things that happen, but that's one of the mechanisms. And the way that clinical trials are using psychedelics, they're kind of treating them like serotonin agonists.
Mhm.
They're giving them to a patient. There isn't much of a sacred container. And so the results that we're getting, there was a study a few years ago of escitalopram, a very famous and well-used antidepressant, compared to psilocybin. And everyone thought, this is it. Psilocybin's going to blow escitalopram out of the water. Everyone knows psychedelics are, the most effective thing. And it showed it was as effective as escitalopram, not more effective. And everyone was very surprised about that. And so we're entering this stage of disillusionment. But I think that for us to progress in medicine and potentially, actually as a species, we really need to be just listening to each other, just listening to what Indigenous people are saying. We don't have to take, to be using everything, but I just feel that the way that we progress with medicine is through this merger of the paradigms, listening to what works, listening to what doesn't work. There are plenty of things that Indigenous medicine is far better at than Western medicine. All things spiritual, most things psychological. But if you're in a car crash, for example, I would much rather go to a Western hospital for battlefield medicine. So I think that's what we need to be doing. We need to be looking at how our knowledge systems can work together rather than looking at the differences and trying to place one above the other in terms of how valid it is.
That's a great point. That's a great point. You made me think of just kind of our tendency in our contemporary cultures, which is in contemporary culture, we do tend to look for a fast and quick relief from something. And so we're not necessarily encouraged or looking to put the time in. And when we have issues, whether ranging, any kind of emotional or psychological issue from, mild depression to, anxiety and other things, there's going to be some work on the individual's part, particularly, and some work that's maybe not so pleasant that is needed to help one get beyond it or to heal it. And I think with and you can tell me if I'm wrong, but with traditional sort of psychiatric medicines, that isn't necessarily part of the prescription. We become overly reliant on the drug to give us the cure rather than being sort of a ground from which we can work on ourselves.
For sure. And we're actually beginning to see that reflected in the psychedelic movement now.
Yeah.
So there are two kind of supposedly cutting edge avenues for psychedelic research at the moment. I think that both of them are, not the way to go. Let's phrase it like that.
Yeah.
And the way to go, and actually the most cutting edge technology that I've ever come across, is in the Amazon rainforest with the Shipibo people with ayahuasca. That is by far the most advanced technology I've ever come across. But most of the pharmaceutical companies are looking for this so-called quick fix and the thing that will make money. And so the two areas that are kind of the hottest at the moment in psychedelic research are, one, psychedelics with an extremely short duration. So we're talking kind of 1 or 2 hours. And so the reason behind this is so that you can come in the morning and do your preparation around breakfast. And then over lunchtime, you take your short acting psychedelic. And then in the afternoon, you have your integration. And then you go home for dinner, and that's your healing is done. Your healing journey was a day.
Right.
I mean, I personally don't think the healing journey ever finishes.
Yes.
It just,
Yeah,
you
yeah.
just go deeper and deeper and deeper.
Yeah.
So that's one, thing they're looking at. The other one is non-psychedelic psychedelics,
Mhm.
or they say non-hallucinogenic psychedelics. So that name can be problematic, but so you basically take a chemical which places your brain into this neuroplastic state so you can more readily form new neural connections, but you don't go through the process because some people don't like going through it. Now, don't get me wrong. There are some people that can't and probably shouldn't as a result of their conditions, for example, psychosis. But again, I think this is really a symptom of people not wanting to do the work and then just wanting that quick fix.
Now, at Unaya, you have a psychedelic mentorship training program. And
We do, yeah.
yeah, let's talk about that. That's exciting.
Yeah, so that was actually the idea for that. Actually came from my own experiences after I was in the Amazon rainforest in 2019, actually collecting the data for my study on epigenetics that was part of my PhD, and still approaching ayahuasca from a Western medical point of view. So I was having these experiences that were getting harder and harder to explain from a Western standing, and having these kind of embarrassing conversations with Don Rono, where he would be saying, "Oh yeah, Simon, that was a spirit, that was an entity, and it was speaking to you." And I would be saying, "Well, I think you'll find, Rono, actually the brain is an expert predictive mechanism, and humans predict faces, and so that's why I keep seeing all these faces." And then thinking like, "Oh man, I'm really struggling to fit this into my paradigm of understanding." And then I went through an experience that I just couldn't deny. I just couldn't deny that the only way that I could prevent myself from losing my mind, it felt, was to switch paradigms, was to start understanding my experiences in the Amazon rainforest from the Shipibo paradigm rather than the Western paradigm.
Mhm.
And so I switched to that Shipibo understanding when I was in the Amazon rainforest. And then after 4 months, when I came back to London to work as a relatively mainstream psychiatrist, I underwent something in retrospect that was called ontological shock. And it's where your perception of reality changes, and then it can cause this confusion and this anxiety. And I was suddenly back in London where nobody thought the way that I was thinking. And a couple of occasions that I did speak to people about my experiences that led me to ultimately actually start my training in curanderismo, I was just kind of met with raised eyebrows. I spoke to my therapist about it. That really didn't go well. And, it was this isolating experience. Fortunately, I had other people who were on the path that I could speak to, so I wasn't completely isolated, but it was a difficult time. And so it just got me thinking about the importance of, especially therapists having an understanding of these different paradigms, of these different modalities, so that when people are working with psychedelics like ayahuasca in a traditional setting, and even sometimes not in a traditional setting, in a hospital,
Mhm.
if they start talking about things like entity encounters, reliving traumas and then these blockages being removed, meeting God, that therapists don't immediately think, oh, they're delusional,
Mhm.
or they at least have an understanding of what it is that could be happening. And so our program, it trains people to do just that, to provide mentorship preparation before psychedelic ceremonies. It's largely heavily based around ayahuasca, but we do talk about other psychedelics. And then also the integration as well. And we look at it from both angles, from the Western psychiatric and psychological. And then we bring in indigenous curanderos. Isa is an expert on the course, which is great. We also have Ayurvedic practitioners, a lot of people from different traditions, so that it's a holistic understanding, so that if you are going between these paradigms as a participant, you can hopefully find a therapist or a mentor who at least has an understanding of what it is you're going through rather than pathologizing it. So that's really how it came to be.
It's a great program. It's a thorough program. And can anyone sign up for this? Do you have to be a psychologist or a psychiatrist, or can you come from other, vocations?
Yeah, absolutely. Anybody can sign up for it. So what we say, it's a fully accredited course. So it is a qualification. And so you can get insurance afterwards and you can start seeing clients. And so we just say that you should operate within your area of expertise. So for example, if you're a psychiatrist, and we have psychiatrists that come and do it, you as a psychiatrist, you now have this additional qualification. If you have no qualifications on paper, and we get a lot of plant medicine facilitators who do the course as well, that's also totally fine. You can use the course either to get a lot of information. As you say, it's thorough. It's a 6-month course with a lot of, well, not a lot of assessments, but it has assessments and go into detail. And if you pass the course, then you can get insurance and you can start seeing people as a mentor as well. So it's really open to anyone. It was important to us that facilitators and also indigenous peoples who might not have those paper qualifications would be able to access the course. So yeah, do check it out.
Yeah.